4 are dead as a result of an active shooter situation at St. Francis Hospital campus there in Tulsa, and that occurred yesterday. And the shooter is also dead from an apparent self-inflicted gunshot wound. Again, at least 4 people are dead and multiple people are injured following a shooting at the Natalie building at St. Francis Hospital in Tulsa, Oklahoma on Wednesday evening. That's according to police. And the victims involved, they were healthcare providers. They were 2 physicians, also a receptionist and another patient were harmed here. And the wounded, it's believed to be as many as 10 people. Now, the 911 call that came shortly before 5 p.m. Really showed that they were reporting that there was a man with a rifle walking toward the Natalie building, a physician's office building on the hospital campus. And as you see in the photo here. Now, when the police responded to the call, they said it turned into an active shooter situation. And that's according to Tulsa Police Captain Richard Mullenberg. And here's a picture of the police captain there in Tulsa. Now, he told CNN that officials aren't releasing the shooter's name yet or any info pertaining to him due to the ongoing investigation at the scene, as well as investigations underway at other locations. And in another statement, he stated that when police found the shooter's dead body beside the rifle, that there was a pistol also on his person. However, the Tulsa Police Deputy Chief Eric Denglish was able to share a few details during a briefing. Here's a photo of him. And what he did is he stated that the shooter is believed to be a man between the ages of 35 and 40. And as for weapons, it did appear that both weapons were fired. Now, the photo of police and other responders entering the building, that is this here, it seems that they were definitely on the scene, although what kind of transpired post-call, we don't necessarily have all the details. And after the Robb Elementary School shooting, we do not want to jump to any conclusions. But what we have been told so far is that when police entered, that they went straight to the second floor where the shooting was taking place and found multiple people shot near an orthopedic clinic. Now, the police say that the gunman targeted a doctor who had performed back surgery, essentially blaming the doctor for his own pain. Police are also investigating a possible bomb threat that may be in connection with the shooter. This per ABC News. Authorities evacuated a home in Muskogee, Oklahoma, about 50 miles southeast of Tulsa after receiving a tip that the suspect may have left a bomb at this residence. Muskogee Chief of Police Johnny Teehee said Wednesday night. A bomb squad was on the scene and police were working to obtain a warrant to search the residence. Now, gun violence this year has been out of control, but before we really dive into that, I would like to know, Yasmin, with this shooting really underway as we continue to have mass shooting after mass shooting after mass shooting, what do you think makes this one a little bit different?
What makes this one different? I mean, whenever we have these mass shootings and they happen so much quicker than we can even respond to it, right? You always kind of hear the same canned responses because there's only so much that anyone can say before actually doing anything, right? So in the case of Robb Elementary, they have all these different excuses for why something happened. And in that case, the police didn't even enter the building until like an hour after there was a shooting already taking place. And so many additional children probably, it was said that they were bleeding out when they could have potentially been saved, right? Whenever first responders were not there. But that's the problem, right? The more that we keep dancing around the issue and avoiding what actually needs to be done, we just keep seeing these shootings happening. And people are getting so tired, especially in a healthcare facility. These people are tired. They've already been dealing with a pandemic and they were not treated well during the pandemic. Now they have to deal with mass shooters. And we can make it about the cops and we can talk about what they could have done or should have done, but cops are first responders. They're not there to prevent the crime. They're there to respond to it once it actually happens. Nothing will change until we get some legislation through that is preventing these things from happening in the first place. Yes. And now, I mean, like this last weekend, ever since the Uvalde school shooting, there have been roughly 20 mass shootings in the United States since then, which was like a week ago. It's too much and people can only deal with it so much before something needs to happen.
Absolutely, and my heart goes out to these healthcare providers because that's exactly what they are. They are providing healthcare. They're trying to take care of people in a society that is pushing policies that are incongruent with taking care of people. And so, as much as we hear that this man, the shooter, was upset about the pain that he was feeling as a result of the surgeon or the doctor's practice, the reality is our society isn't set up for people's pain to be addressed. It's not set up, and it's not advancing, curing, or helping people. And the thing is, these doctors do the best they can. And it's just incredibly, incredibly disheartening and sad to know that they are under attack now. Because what we're definitely seeing across the board is gunfire going up everywhere, and now to see it in a hospital. But this per CNN about the gun violence rates this year. There have been so far at least 233 mass shootings in 2022, according to the nonprofit organization Gun Violence Archive. That includes yesterday's shooting in Tulsa. June 1 was the 152nd day of the year. And this means that there have been more mass shootings this year than that there have been days in 2022. And we're not hearing anything encouraging from leaders in terms of making the changes that are necessary to prevent these mass shootings. Like the Oklahoma Republican governor, Kevin Stitt, well, he issued a flowery statement. Yesterday, he said, what happened today in Tulsa is a senseless act of violence and hatred. Sarah and I are praying for their families of those who lost their lives and for those who were injured. Yeah, thoughts and prayers isn't enough. We actually need action. But of course, the governor went on to say how grateful he was for Tulsa PD, additionally stating that he offered state resources to the mayor. And then he closes with a kumbaya, let's come together for the community. And this is absolute and utter nonsense when actual action could do something. Meanwhile, we're just a day after the Uvalde shooting in Oklahoma, and that continues. We're just a week out about that. But also the leaders, they're not necessarily seeking to figure out how to further expand these gun regulations and restrictions. Rather, they are busy trying to expand Oklahomans' access to firearms. Currently, right now on Stitt's desk, waiting to be signed, is a House bill. It's Oklahoma House Bill 3144, which it would prohibit the state from contracting with financial institutions that refuse to deal with firearms dealers and industries. Yeah, for real. And this measure, it was first proposed during a legislative study examining ways to attract a firearms manufacturer to the state. So clearly there seems to be some disconnect between these thoughts and prayers and actual action, because apparently people in positions of power want more firearms in their state, even though it is costing the lives of their leaders. Yasmin.
It really makes you wonder, the people who are still supporting people like the governor of Oklahoma and even the governor of Texas, they keep saying one thing, but then they're doing something else, and it's obviously hypocritical. But then I say obviously, but then I have to wonder, is it obvious? Because so many people are still supporting these politicians, thinking that this is gonna make their lives better somehow, right? And the issue with gun control specifically is an interesting one, because both sides of the argument, they just want to feel safer, right? One side wants to feel safer by arming themselves and protecting themselves and taking that autonomy onto themselves. And the other side says, no, just get rid of all the weapons and then we can't get hurt by them, right? So there's two different approaches to the issue. And especially here in Texas, I feel like we have a kind of a unique perspective on both sides of that argument. And that said, I'm not trying to say that this is really a comparable argument as far as what is right and what is wrong. The thing is, right now we have a problem that is unique in the United States, right? No other country has this issue the way that we do here. Other countries, they have issues of mental health crises. They have issues with just crime rampantly in their countries, but they don't see things like mass shootings, especially not in schools and especially not in hospitals. So the longer that we keep dancing around this issue and keep pretending like it's one thing or another, when we know what the actual issue is, the longer these things are just going to keep happening. And I'd be interested to see how long people keep supporting politicians like the governors of Oklahoma and Texas, the longer that they keep avoiding the problem.
Yeah, well, I definitely think they're going to continue supporting them as long as people are kept stupid, because that's the goal. It makes it easier to control people.